Okay, welcome and tell something about Padmaja madam. Immediately Padmaja madam will take care.
Good evening, everybody. Today, our senior member, Padmaja Madam, will be speaking to us on arthritis cases. She is a very long-standing member of NPSA. She has worked for Andhra Bank in her earlier days, and she had also addressed us in various occasions also here. Now, I welcome and I request Padmaja Madam to continue the program. Welcome.
Thank you, sir, for introducing me. Is my voice audible?
Yes, yes.
Respected sir and other allied group members, I am Padmaja from Hyderabad. Today's topic is joint pains. So, in this topic, I am not discussing about gout as per instructions from our Mufti sir. So, gout was eliminated in this topic. You please take a note. So, before entering into the topic, I want to introduce. So let us, I will start my presentation. But I need some help today. There are no helpers for the speaking. So I will try. Is it now coming?
You have to open your program. You can open your program.
That screen broadcast is blinking in red button.
Yeah, it is not open it. You touch the red button once again, please.
No, it's not going.
It's not open.
Maybe by mistake I pressed this stop button first. I think.
Yeah, maybe that is the reason. You can
So
stop.
what to do, sir? Now
You come back. Go once again.
how to come back?
You stop
Okay.
broadcasting. Now you again press.
Screen broadcast again. I have to press.
Yeah, you press that arrow. It will show present now, and then it will show full screen. Then you open your program.
Arrow is presses many times and the screen broadcast
Yeah.
stop.
Don't stop it. Let the screen be broadcasted.
Now it is coming. Now it is coming.
Yeah, it's coming now. It is still showing.
Now it is coming.
Fine. Now it's fine. Now you can open your program.
Yeah, I have to
Your presentation you can open. Then it will come. Yeah, you can see your screen now. So you open your screen, your program, it will come. Yeah, it's coming. Pooja. You can start from the beginning.
Okay, I will start it.
Yeah, fine. Yeah.
Thank you, sir.
Welcome.
So before entering into the topic, just I want to give a brief introduction about rheumatic diseases and arthritis. Because the heading is like that, so everybody will get confused. So I want to clarify. Rheumatic diseases usually affect joints, tendons, ligaments, bones, and muscles. They can cause pain, stiffness, and swelling in the joints. Rheumatic diseases can also affect the other areas of the body, such as eyes, mouth, lungs, heart, and skin. It means dry eyes, dry mouth, dry skin, like psoriasis, like that. So not only it affects the joints, tendons, ligaments, bones, and muscles, but also these areas are also will affect by rheumatic diseases. Some rheumatic diseases affect connective tissues, others may be caused by an autoimmune disorder. This is the case rheumatic diseases. And now, what is arthritis? Arthritis is also a type of rheumatic disease. Arthritis means inflammation or swelling of one or more joints. It describes more than 100 conditions that affect the joints, tissues around the joint, and other connective tissues. There are so many types of arthritis is there. Rheumatoid arthritis, osteoarthritis, psoriatic arthritis, ankylosing arthritis. Like that, so many conditions are there. It will give you more than 100 conditions. So, arthritis affects others of all just affect not related. Difference between arthritis and rheumatic disease. Arthritis is often used to refer any disorder that affects the joints. Rheumatic diseases usually affect joints, tendons, ligaments, bones, and muscles. This is the difference. So arthritis means only it will reveal the about joints and issue around the joint. So what is a joint? The joint is where two bones meet. Most of our joints are designed to allow the bones to move in certain directions and within certain limits. The end of each bone is covered with cartilage that have a very smooth, slippery surface. The cartilage allows the ends of the bones to move against each other almost without rubbing. The joint is held in place by the synovium, which contains thick fluid to protect the bones and joints. The synovium has a tough outer layer that holds the joint in place and stops the bones moving too far. Tendons are tough, flexible bonds that connect the muscles to bones and can help to move the joints. Ligaments connect the bones of the joint to each other to keep them stable when we move. Shoulders, elbows, hips, knees, and knuckles all are joints. Spine has many joints too. Now we can here we can see the healthy joint diagram and damaged joint. Here we can see clearly how the changes are placed in ligament, cartilage, and joint lining. The healthy joint and joint, damaged joint. Joint disorders. Joint disorders happen overuse of the
లెక్క అక్కడే
joint
ఉంటుంది
or because of a sudden injury,
నొప్పి మాత్రం
fracture, an accident, or a sport injury.
చల్లారకి తాగండి బాగా.
Overuse injuries usually damage the soft tissues of the joint. They can happen when we use a joint too hard by doing the same movements over and over. For example, for playing a musical instrument, playing sports, or doing certain jobs. So, joint disorders will happen because of overuse of the joint. Joint diseases. Many diseases can affect the joints. They often cause joint pain and make the joints stiff, red, or swollen. Most of them are chronic. That means they last for a long time. Some may never go away completely. So, some of the joint diseases are back pain, neck pain, knee pain, arm pain, hand pain, ankle pain, hip pain, shoulder pain, and let us discuss about the first one, neck joints. Neck is the upper portion of the spine and also called the cervical spine. The neck starts at the base of the skull and extends down to the thoracic spine. Neck joins the head with its trunk and limbs. It provides support for the weight of our head. The average human head weighs about 10 pounds. Neck is responsible for supporting this weight and keeping the head aligned with the rest of our body. Neck surrounds and protects spinal cord and allows for a wide range of head movements. Neck is made up of 7 bones stacked one on top of the other. These bones are called cervical vertebrae and are numbered even to C7. Each bone is separated and cushioned by shock absorbing discs. The vertebrae are connected by facet joint and also bound together with ligaments. The cervical spine contains the spinal cord along the length of the spinal cord. Spinal nerves emerge through spaces between the vertebrae to connect with the nerves throughout the body. Muscles provide movement and vital support for all structures of the neck. Neck pain can involve damage to bones, muscles, discs, or ligaments, but pain can also be caused by damage to nerves or the spinal cord. Neck pain is also known as cervicalgia. As we grow older, our cervical spine undergoes changes due to decades of normal wear and tear. Starting in the middle age, the discs between our vertebrae start to change. Cartilage wears out over time, discs lose their volume and become dried and cracked. Ligaments may thicken and bone spurs may form where bones rub against each other in areas that are no longer covered with cartilage. All these changes are defined as cervical spondylosis. These changes can lead to compression of the spinal cord or nerve roots, causing pain, stiffness, and other symptoms in our neck. Cervical spondylosis may lead to white matter damage, gray matter volume loss, and functional adaptive changes in the sensory motor cortex. So not only it will damage the joints and this thing, but this also affect white matter, gray matter, like that, and functional adaptive changes in sensory motor cortex. Cervical spondylosis is usually occurs in people older than 50 because of the wear and tear of the cervical spine. Sometimes this pain gets better in few days. Other times neck pain or stiffness may last for weeks or even months. Spondylosis versus spondylitis versus spondylosis. Spondylitis and spondylosis are terms used to describe conditions that affect the spine. Both conditions cause back or neck pain and stiffness. But while they may sound similar, these terms differ to different conditions. Spondylitis. Spondylitis refers to inflammation of spinal joints. Spondylitis can be caused by an infection, arthritis, or by an autoimmune disease which affects the joints and surrounding tissue. Spondylosis. Spondylosis is a degenerative condition caused by age-related changes in the spine. It commonly affects the cervical spine, leading to cervical spondylosis. These changes involve the intervertebral discs, vertebrae, and facet joints, which can cause pain, stiffness, and other symptoms. Both spondylitis and spondylosis are chronic conditions. This means they can both last for many years and may even be lifelong. There is no cure for either spondylitis or spondylosis, but with proper treatment, most people with these conditions can manage their symptoms and live relatively normal lives. Causes for neck pain. There are a number of problems that cause pain in the neck. Aging, poor posture, repetitive motion, sleeping in an uncomfortable position, carrying heavy weights, pinched nerves, sport injuries, or other injuries, accidents, arthritis. Usually, osteoarthritis will affect the joints. Infection, tumors, narrow spaces within the spine, that is spinal stenosis, a ruptured or herniated disc, heart attacks, meningitis, fibromyalgia, that means chronic pain in muscles and other soft tissues. Symptoms: headache in the back of the neck, stiffness and pain in the neck, pain in shoulder blades, arms, hands, and fingers, tingling or numbness in arms or hands, weakness in the arms or hands may develop slowly, lack of coordination, difficulty in walking, loss of balance, loss of bladder or bowel control, pain that increases in standing, sitting, sneezing, or coughing, being unable to turn the neck or tilt the head. Prevention. Take preventive steps to avoid neck pain like practicing good posture and taking frequent breaks to move and stretch. Avoid carrying heavy weights, sleep in a healthy position, quit smoking, stay active. Homeopathy remedies for neck pain. Here I have given all the details and the symptoms, but I am not reading all these things because of the time gap. And Surendra sir wants to take a class on joint pains. Sir will explain all these medicines for us. Okay. So, homeopathy remedies for neck pain. Acid fast, aconite, antintar, arnica, bryonia, calcarea fast, Chelidonium, Misifuga, Carpillus, Olocin, Onium, Dulcamera, Gelsemium, Diacum, Hypericum, Calliiode, Almia, Leptanthus, Meserium, Paris quadrifolia, Rhododendron, Rustox, Ruta, Spigelia, Theridium. I, I have given some medicines. That is my clinical experience. What are the medicines I am giving? I am for stiff neck and neck pain, I have given Bryonia, Sincitiga, Dulcamera, Latmanthus, Asta, Rhododendron. For Parietis spondylus, acid fast, Bryonia, Conium, Oculus, Calcarea fast, Dulcamera, Latmanthus, Kalmia, Gelsemium, Rustox. These medicines worked very well in these complaints. Now, the second one is shoulder joint. Shoulder is the most mobile joint in the human body. Normally, the shoulder has a wide range of motion, but because of this flexibility, it is not very stable and is easily injured. Shoulder is made up of three bones. The humerus, which is the upper arm bone, the scapula, which is the shoulder blade, the clavicle, which is the collarbone. These bones are cushioned by a layer of cartilage. There are two main joints in the shoulders. Shoulder is a ball and socket joint. Acromyoclavicular joint, where the top of the shoulder blade meets the collarbone, that is clavicle. That joint is called acromyoclavicular joint. Second one is glenohumeral joint, where upper arm humerus connects with shoulder blade, scapula. Shoulder gets the range of motion from the rotator cuff. The rotator cuff is made up of a group of four muscles and their tendons. Tendons are the tissues that connect the muscles to bone. The shoulder joint is highly dependent on the surrounding muscles and ligaments to hold it in place. As a result, it is easy to experience sprains, strains, dislocations, separations, tendinitis, torn rotator cuff, and fractures. Shoulder pain is any pain in or around the shoulder joint. When you have shoulder pain, it could come from any part of the shoulder, including bones, cartilage, muscles, tendons, and nerves. You may have pain when lifting the arm above your head or moving it forward or behind your neck. Causes for shoulder pain. The most common cause of shoulder pain occurs when rotator cuff tendons become trapped under the bony area in the shoulder. The tendons become inflamed or damaged. This condition is called rotator cuff tendinitis or bursitis. Shoulder pain may also be caused by arthritis in the shoulder joint. The most common type of arthritis in the shoulder joint is osteoarthritis. Bone spurs in the shoulder area. Bone spurs consist of excess bone growth around joints and are common in older adults. Bone spurs can narrow the spaces for nerves, pinching or irritating them. This can make shoulder stiff, painful, or numb. Bursitis, which is inflammation of a fluid-filled sac, bursa, that normally protects the joints and helps it to move smoothly. Broken shoulder bone, dislocation of the shoulder, shoulder separation, frozen shoulder which occurs when the muscles, tendons, and ligaments inside the shoulder become stiff, making movement difficult and painful. Overuse or injury of nearby tendons such as bicep muscles of the arms. Nerve injury that leads to abnormal shoulder movement. If the shoulder is numb, the nerves in shoulder joint are probably involved. Nerves travel through the neck and back to shoulder. They run through shoulder and upper arm all the way to fingertips. Nerve damage in shoulder can cause symptoms in the hand, other areas like neck, shoulder, arm, hand, or fingers. Tears of the rotator cuff tendons. Rotator cuff tendinitis may be due to keeping your arm in the same position for long periods of time, such as doing computer work, sleeping on the same arm each night, playing sports that require you to move your arm over your head repeatedly, such as tennis, basketball, swimming, and weightlifting. Poor shoulder postures and mechanics. Sometimes shoulder pain may be due to a problem in another area of the body, such as the neck, lungs, heart, gallbladder, or liver. This is called referred pain. Symptoms. Shoulder pain symptoms depend on the condition which is causing it. Symptoms associated with shoulder pain can include pain in your shoulder at rest, pain when you move your shoulder, pain when you lift heavy objects, limited shoulder range of motion, popping or clicking sound when you move your shoulder, weakness in your arm or hand, numbness in your arm, your shoulder joint feeling unstable. Some shoulder conditions are due to simple trauma or inflammation. For most people, shoulder pain will improve over time with appropriate treatment. Diagnosis. Imaging tests such as X-rays, MRI, CT scan, electromyography, and arthroscopy may help to diagnose the problem. Precautions. Rest and doing exercise, altering your activities, avoiding overexertion or overdoing activities, having good shoulder posture. Homeopathy remedies for shoulder pain. Arnica, Beretta, Bryonia, Berberis vulgaris, Cactus, Calcarea fos, Carbolic acid, Chamomilla, Castica, Chelidonia, Chenapodium, Simsifuga, Fulosynthis, Honium, Dulcamara, Ferramid, Gelsinium, Guaiaca. Hyperica, Calicar, Kalmia, Liosol, Lagnanthus, Medampal, Lycoperisco, Magnesia car, Myrica, Phytoleca, Lumbamet, Podophylla, Ranunculus bulb, Rhododendron, Rustax, Ruta, Sanguinaria, Sticta, and Sulfur. I have given these medicines for shoulder pain. For right shoulder pain, Sanguinaria, Chenapodium, Phytolecta, Sticta. Left shoulder, Castica, Ferramnet, Creosote. The scapular region, Chelidonia, Chenapodium, Kalmia, Calicar, Podophylla, Vanonbulb, and Rusta. For frozen shoulder, Rusta, Sanguinaria, Ferramnet, Bryonia, Gelsinium, Medampa, Syndicifluga, Calcarea fos, Rhododendron, Carbolic acid, Guaiaca, Lycopodium, Mesoreum, Folosem, Chamomilla, Ruta, Columbamet, Hypercon, according to symptoms. So with this, I have told so many shoulder pain. Now the third one, elbow pain. The elbow is a hinge joint connecting the forearm to the upper part of the arm. Hinge joint allows you to extend, flex, and rotate your hand and forearm. Elbow is made up of three bones: the humerus, which is in the upper arm, and two long bones called the ulna and radius in the lower arm. The bones are held together by ligaments to provide stability to the joint. Elbow pain is often caused by overuse or injury. Many sports, hobbies, and jobs require repetitive hand, wrist or arm movements, which are the main cause of elbow pain. Elbow pain may occasionally be due to arthritis, but in general, elbow joint is much less likely to have wear and tear damage than are many other joints. Common causes for elbow pain: broken arm, bursitis, dislocated elbow, osteoarthritis, sprains, shoulder problems, tendinitis, trapped nerves, tennis elbow. Symptoms of elbow pain. Some of the symptoms of elbow pain include dull ache when at rest, pain when making a fist, pain when opening the fingers, soreness around the affected elbow gum, weak grip, difficulty and pain when trying to grasp objects, especially with the arm stretched out. Tennis elbow. Tennis elbow means not only players will get but also the other adults also will get this elbow pain. Tennis elbow is painful inflammation of the elbow joint caused by overuse of the arms or a traumatic blow to the hand. The pain is located on the outside, that is lateral side of the elbow, but may radiate down to the back of forearm. In tennis elbow, the pain will be at the lateral side of the elbow, but in one more, I have forgotten it. You will likely feel the pain when you straighten or fully extend your arm. Anybody can develop tennis elbow, but it is most common between the ages of 40 and 50. Anyone who regularly performs repetitive activities that vigorously use the forearms, wrists, or hands can get tennis elbow. Tennis elbow can affect recreational and professional. The second one is golf elbow. Golf elbow will come the inner side of the elbow. You can feel that pain in the inner side of the elbow. Tennis elbow is more common in these conditions. They are overuse injuries linked with activities involving repetitive actions of the wrist and hand. For example, sportsmen, musicians, etc. People who are continually gripping and twisting, for example, carpenters, plasterers, or people who use computer mouse may be at risk. The repetitive actions combined with weight, for example, lifting heavy boxes, can also cause these problems. Symptoms. The main symptoms are pain and tenderness on the outside of the elbow. People may also have pain when gripping. Diagnosis. X-rays, CT scan, MRI, and EMG can help. Prevention of elbow pain. Most elbow disorders are result of overuse and injury. You can prevent them by taking breaks from repetitive tasks, practicing exercises that can help strengthen the muscles around the elbow joint, correcting improper sport techniques, warming up and stretching properly, using elbow padding. Homeopathy remedies for elbow pain. Acid salicylic, agaricus, allium cepa, ambrosia, antincrude, epismale, argentum nut, arnica, arsenical, belisper, bryonia, calcarea cal, calcarea flor, castica, chamomilla, cinnaberis, Oculus, Phonium, Diacum, Hypericum, Calibite, Calicar, Caliiode, Calmia, Ladampa, Lycopersicum, Pulsatilla, Rhododendron, Rustox, Ruta, Sanguinaria, and Viscomalva. I have treated elbow pain with these medicines. Rustox, Agaricus, Ambrosia, Allium cepa, Ruta, Calibite, Spilla, Lacapaz. These medicines work very well in those cases. Wrist joint. The wrist joint, also known as the radiocarpal joint, is an articulation between the radius and the carpal bones of the hand. It is condyloid type synovial joint which marks the area of transition between the forearm and the hand. Wrist is actually a collection of multiple bones and joints. The bones comprising the wrist include the distal ends of the radius and ulna, 8 carpal bones, and the proximal portions of 5 metacarpal bones. All these bones participate in complex articulation that allows variable mobility of the hand. There are 4 main ligaments located at the wrist. There are 6 main muscles that flex the wrist. These 6 muscles of the wrist and the forearm are very active in daily activities. The wrist joint is highly mobile joint to allow the hand to move in several directions. Because of this, the wrist joint is prone to injury. Common causes for wrist pain. Injuries. Wrist pain with bruising or swelling is often a sign of an injury. A sprain type injury is when a ligament is damaged. Wrist injuries often occur when you fall forward only onto your outstretched hand. This outstretched arm and the extended wrist position can cause tearing of ligaments of the wrist. This can cause strains, and even fractures. Carpal tunnel syndrome. A common cause of wrist pain is carpal tunnel syndrome. The carpal tunnel is an area in the wrist that is created by wrist bones and which contain the median nerve and tendons. It occurs when there is a pressure on the median nerve causing aching, numbness, burning, tingling, and weakness in our palm, wrist, thumb, or fingers. There may also be swelling on the thumb side of the wrist and a catching or snapping sensation when moving the thumb. These conditions may be related to overuse injuries due to repetitive stress on the wrist. Blood pressure, diabetes, rheumatoid arthritis, and obesity may increase the risk of developing carpal tunnel syndrome. Here you can see the carpal tunnel. See the ligament and the bones form like a tunnel, and they press the median nerve, that yellow one. Because the nerve is pressed, you will feel that pain. Arthritis. Arthritis is an inflammation of the joints. This condition can cause swelling and stiffness in the affected body part. Arthritis has many causes, including normal wear and tear, aging, and overworking the hands. There are many forms of arthritis, but the most common type that can affect the wrist include rheumatoid arthritis. But the most common types that can affect the wrist include rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease that can affect both wrists. Osteoarthritis. Osteoarthritis is a degenerative joint disease that is common among older adults. It is caused by a breakdown of the cartilage that covers the joints. Wrist tendinitis. Wrist tendinitis refers to inflammation of a tendon within the wrist. This condition typically causes pain and swelling and may result in a reduced range of movement in the wrist. Kienbock's disease, a rare disease that causes the lunate bones in the wrist to slowly break down due to low blood supply. So blood supply is not properly to that bone, so it will damage. Symptoms of the wrist pain: swollen fingers, difficulty in making a fist or gripping objects, numbness or tingling sensation in hands, sudden sharp pain in the hand, swelling or redness around the wrist, warmth in a wrist joint. Diagnosis: X-rays, electromyography, nerve conduction velocity test. Prevention of wrist pain: build up bone strength, prevent the falls, use the protective gear for athletic activities, wrist exercises for strengthening the wrist. Homeopathy remedies for wrist pain: abrotanol, actia spicata, arnica, belispar, bryonia, calophylla, casticum, proicicum, lipitorium pel, hypericum, calicar, lycopodium. Magphos, Metrophos, Pulsatilla, Rastax, Ruta, Stricta, Trimethylamine. I have treated wrist pain with these medicines. Actias picata, Calophyra, Picatodental, Calica, Pulsatilla, Magphos, and Metrophos. Finger joints. There are 14 narrow bones called phalanges in fingers. Each finger contains 3 phalanges, proximal, middle, and distal. The thumb has 2 phalanges only, proximal and distal. Each finger has 3 joints, metacarpophalangeal joint, that is MCP joint, also called the knuckle. This is the joint where the finger bones meet the hand bones base of the finger. Proxima interphalangeal joint, PIP joint. This is the joint in the middle of the finger connecting the proximal and middle phalanges. Distal interphalangeal joint, DIP joint. This is the joint closest to the fingertip connecting the middle and distal phalanges. Thumb has only one joint called interphalangeal joint, IP joint. The IP joint in thumb is located at the tip of the finger just before the fingernail stops. The thumb does not have a DAP joint or a distal phalanx bone. Carpo-metacarpal joint, CMC. The CMC joint is located at the bottom of the hand bone. This joint is at the base of the thumb and also at the base of other fingers. This joint varies in each finger. All these joints are very important, allowing us to bend, flex, and spread our fingers. The finger joints provide movement and allow to perform activities such as grasping, etc. Common causes for finger pain. Finger injuries. Some common injuries are a sprain, which refers to a stretched or torn ligament, a strain, when a muscle or tendon becomes stretched or torn. Dislocation, when something forces a finger bone out of its joint. Fractures. A fracture can happen to any of the bones in fingers from a fall or other sport injuries. Arthritis. Pain in finger joints due to arthritis. This condition can cause swelling and stiffness in the affected part. Arthritis has many causes, including normal wear and tear, aging, and overworking the hands. Carpal tunnel syndrome. Carpal tunnel syndrome affects the median nerve, which extends from the forearm through the carpal tunnel and into the palm. This nerve provides the sensory and motor functions to the thumb, index, and middle fingers. So people may experience pain or numbness if it becomes compressed inside the carpal tunnel. Tendonitis. Tendonitis occurs when a tendon becomes inflamed, which can lead to swelling, discomfort, and reduced movement. Trigger finger or tenosynovitis. Tenosynovitis refers to inflammation of the tendon sheath, which is the thin membrane that encloses a tendon. This condition often affects the thumb and ring finger, but it can also affect any of the other fingers. Symptoms include pain, stiffness, and a locking or catching sensation when you bend or straighten your finger. Diabetes. Uncontrolled diabetes can lead to various musculoskeletal complications that affect the hands and fingers, such as carpal tunnel syndrome and diabetic neuropathy. Symptoms. Numbness or tingling in fingers or hands. Difficulty in moving or strengthening the fingers. Straightening the fingers. A finger that appears discolored or swollen. Diagnosis. X-ray, CT scan or MRI. Prevention. Proper wear while playing sports. Regularly take breaks between repeated hand movements. Maintain a healthy lifestyle. Keep blood sugar levels under control. Homeopathy remedies for finger pain. Actiaspecta, agaricus, antimonium crudum, epismate, argentum, Berberis vulgaris, borax, Palophyllum, Casticum, Colchicum, Palaturium. Galtera I, Graphitis, Hypericum, Vedampod, Myristica, Natramur, Propylaminum, Pasatilla, Rustax. I had treated this finger pain at the time of chikungunya, Actias pigita, Agaricus, Calophila, Rustax, and Pasatilla. Now, spinal joints. Spine is made of 33 bones called vertebrae that are stacked on top of one another. The top 24 bones are mobile. Other vertebrae of the sacrum and coccyx are fused. Spine connects different parts of our musculoskeletal system. In all, our spine has 364 joints. The three main functions of the spine are to protect the spinal cord, nerve roots, and several of the body's internal organs. Provide structural support and balance to maintain an upright posture. Enable flexible motion. Each vertebra and spine has a hole in the center, so when they stack on top of each other, they form a hollow tube that holds and protects the entire spinal cord and its nerve roots. The spinal cord is the column of nerves that connects the brain with the rest of the body and carries messages from brain to the other parts of the body. The vertebrae protect and support spinal cord. Vertebrae also bear the majority of weight put upon the spine. The vertebrae are numbered and divided into regions: cervical, thoracic, lumbar, sacrum, coccyx. Each region has specific characteristics and functions. Cervical spine. The neck region of the spine is known as the cervical spine. This region consists of 7 vertebrae which are numbered C1 to C7. These vertebrae protect the brain stem and the spinal cord, support the skull, and allow a wide range of head movement. Thoracic spine. The center portion of the spine is called thoracic spine. Beneath the last cervical vertebrae are the 12 vertebrae of the thoracic spine. These are labeled T1 to T12. These vertebrae connect to ribs and form a part of the back wall of the thorax, the rib cage area between the neck and diaphragm. The main function of the thoracic spine is to hold the rib cage and protect the heart and lungs. The range of motion in this region is limited. Lumbar spine. Lumbar spine has 5 vertebrae named L1 to L5. The main function of the lumbar spine is to bear the weight of the body. These vertebrae are much larger in size to absorb the stress of lifting and carrying heavy objects. Sacrum. The sacrum is located behind the pelvis. 5 bones named S1 to S5 fuse into a triangular shape form the sacrum. The main function of the sacrum is to connect the spine to the hip bones. The last lumbar vertebra L5 articulates with the sacrum. The nerves that leave the spine in the sacral region control the bowel and bladder functions and give sensation to the crotch area. Coccyx. 4 fused vertebrae make up this small piece of bone found at the bottom of the spine. Pelvic floor muscles and ligament attached to the coccyx. It does not contain the spinal cord. Most vertebrae move to allow for a range of motion. The lowest vertebrae, sacrum and coccyx, are fused together and don't move. Spinal curves. The spine has 3 natural curves that form S shape. The curves work like a coiled spring to absorb shock, maintain balance, and allow a range of motion throughout the spinal column. The abdominal and back muscles maintain the spine's natural curves. Intervertebral discs. Between each vertebra, there is a soft gel-like cushion called disc that helps to absorb pressure and keep the bones from rubbing each other. Discs function like coiled springs. Facet joints. The joints of the spine are called facet joints. Each vertebra has 4 facet joints. They link the vertebrae together and give them flexibility to move against each other. Common injuries to the vertebral column. Back pain can be acute or chronic. This can be due to muscular or ligament strains due to herniated discs. Herniated disc. Soft tissues in the discs between the joints comes out, causing pain and pressing on nerves. Bulging discs. These protrude but not as much as herniated disc. Continuous symptoms are not experienced only when the bulging disc pushes on a nerve root. Degenerative disc disease. The discs between vertebrae shrink or tear, which causes the bones to rub together. Where are inflammation of the sacroiliac joint, where spine and pelvis meet, swelling and wearing away of the joint cartilage through injury or arthritis. Spinal stenosis. Narrowing of the spinal canal, adding pressure to the spine and nerves, causing numbness in the legs. Cervical radiculopathy. A pinched nerve usually caused by a bone spur or a herniated disc. Spondylolisthesis. Listhesis. Often starts with a small fracture in an obscure area of the facet joint known as the os. Left unchecked, a false defect can develop into spondylosis and finally spondylolisthesis, where a bone in the spine slips forward and out of place. The degenerative form of arthritis, which weakens the joint and ligaments, keeping the spine aligned. Osteoarthritis. Degenerative joint disease which occurs when cartilage breaks down. Scoliosis. Curvature of the spine. Pain typically starts in the midline. Sciatica. Acute pain from the sciatic nerve radiating to the buttocks and sometimes the feet. Symptoms. Stiffness in the back region, stinging, burning pain in the lower back, numbness and tingling, dizziness and headaches, back pain with fever. Bowel or bladder control issues. Leg weakness or pain that moves from your back down your legs. Pain that worsens, causes nausea or sleeplessness or interferes with daily activities. Diagnosis. X-rays, CT scan, MRI, bone density scan. Prevention. Remain active. Do abdominal muscle strengthening exercises to provide more spine stability. Use correct lifting and moving techniques. Maintain a healthy weight. Extra weight, especially around the midsection, can put strain on the lower back. Don't use tobacco. Smoking affects the lungs health, but it also speeds up cartilage loss in the joints and aggravates back pain. Smoking is a risk factor for atherosclerosis, hardening of the arteries, which can cause lower back pain and degenerative disc disorders. Maintain correct posture when you are sitting or standing. Avoid stressful situations if possible, as this can cause muscle tension. Homeopathy remedies. Exclusively agaricus, albumina, argentum nitricum, arnica, belladonna, calcarea car, casticum, carbonium cell, sinicifluga, Carpillus, conium, Formicum acidicum, Aclalava, hypericum, Nacromur, Naxomica, citric acid, Calcitilla, Guta, Silesia, Strychnine phos, sulfur, Symphyton, Tarantella, Theridium, Thiocinaminum, Zincaminate. Curvature of the spine, scoliosis. Scoliosis is a sideways curvature of the spine that most often is diagnosed in adolescence. While scoliosis can occur in people with conditions such as cerebral palsy and muscular dystrophy, the cause of the most childhood scoliosis is not known. Most cases of scoliosis are mild, but some curves worsen as children grow. Severe scoliosis can be disabling. Medicines for scoliosis. Calcarea car, Secutagar, phosphorus, Silesia. I have given medicines for back pain. Arnica, belladonna, bryonia, Belisver, Simsifluga, Carpillus, Calcarea phos, Calibi, Hypericum, Rasta, Ruta, Symphytum, and Zucalpine. For Cotics, the patient cannot sit on the floor. Jantina, it was very well. For these problems I have given arnica, ammonia carb, belladonna, bryonia, calibyte, calidar, rasta, and ruta. Pain in hip joint. Hip joint is one of the largest joints in our body, forms a hinge between the pelvis and thigh bone. It's a ball and socket joint and aids a lot of movement in the human body. It also takes the pressure of the torso and the legs and is crucial for balance and mobility activities such as walking, sitting, and carrying things around. Due to frequent activity on the hip, there can be many hip pain causes. Possible causes. Hip pain is a symptom of several conditions, including arthritis, injuries to hip, fractures, labral tears and dislocation, bursitis, and structural issues. Athletes, dancers, and gymnasts who move their hips in all directions and are more likely to injure their hips and have hip pain. Arthritis causes pain and inflammation in joints. Hip arthritis is common. It causes symptoms like pain, swelling, and stiffness. Osteoarthritis, rheumatoid arthritis, ankylosing spondylitis can lead to pain in hips. Bursitis is painful swelling in a small fluid-filled tract called bursa. Bursa cushion spaces around bones and other tissue. Hip bursitis happen when the bursa in hip becomes irritated and swells. Any injury that damages the parts of the hip joint can cause pain. Hip injuries are usually caused by repetitive strain injuries, sport injuries, trauma like falls or accidents. Some of the most common injuries that cause hip pain include hip muscle strain, especially hip flexor strains, tibial band syndrome, hip labral tears, bone fractures, hip dislocations. Some people are born with conditions that affect the shape of their hips. These conditions are called structural or developmental abnormalities. Irregularly shaped bones forming the hip joint, such as with hip dysplasia and impingement, can lead to abnormal symptoms. Symptoms of hip problems may include pain in the hip joint, usually felt in the groin area, referred pain to the thigh and knee, limping, reduced range of motion, stiffness, pain when trying to put weight through the leg on the affected side. Risk factors: age, excess weight, injury, overuse, gender. Diagnosis: X-rays, CT scan, MRI scan, blood test. Prevention: avoid sitting in low chairs as this bends the hip more and might increase the pain. Don't carry heavy weights. Lessen the strain on your hip at work by finding a comfortable sitting position. Lose weight if you are overweight. Homeopathy remedies for hip pain: agaricus, arnica, bryonia, calcarea fos, syncytial, colocin, phonium, hypericum, calibyte, calicar, caliiode, mercilode, natron salt, pulsatilla, ruscox, ruta, sanguinaria, stramonium, stellaria, symphytum, sticta, and targa. For hip joint, given for hip fracture, I have given arnica, calcarea fos, bryonia, ruscox, ruta, and symphytum. For pain, agaricus, bryonia, syncytial, hypericum, calicar, and ruscox. Pain in knee joints. The knee is the joint between the bones of upper and lower leg. It allows the leg to bend and provides stability to support the weight of the body. The knee supports Motions such as walking, running, crouching, jumping, and turning. Several parts help the knee to do this job, including bones. Tibia, shin bone or larger bone of the lower leg. Femur, thigh bone or upper leg bone. Patella, kneecap, cartilage. Each bone end is covered with a layer of cartilage that absorbs the shock and protects the knee. Muscles. Two groups of muscles involved in the knee. Quadriceps muscles and hamstring muscles. Ligaments. Ligaments are elastic bands of tissue that connect bone to bone. Tendons. Tendons are tough parts of tissue that connects muscles to bones. Many of these parts are susceptible to disease and injury, which can lead to severe knee pain. The location and severity of knee pain may vary depending on the cause of the problem. Causes. The most common causes of knee pain are related to aging, injury, or repeated stress on the knee. Common knee problems include sprain or strained ligaments, cartilage tears, tendonitis, and arthritis. These are some of the more common causes of knee pain. Overweight. Being overweight puts at greater risk for knee problems. Obesity and excess weight are major contributors to chronic knee pain. Overuse. Physical activities, exercise, playing sports, and doing physical work can all stress the knee joint. Doing the same repetitive motion can cause knee pain. Arthritis. Osteoarthritis is the most common type of arthritis that affects the knee. Osteoarthritis is a degenerative process where the cartilage in the joint gradually wears away. Rheumatoid arthritis can also affect the knees by causing the joint to become inflamed and by destroying the knee cartilage. Baker cyst, a fluid-filled swelling behind the knee that may occur from other causes such as arthritis. Cancers, cancers that either spread to bones or begin in the bones. Infection, infection in the bones around the knee or infection in the knee joint. Sprained or strained knee ligaments or muscles. A sprained or strained knee ligament or muscle is usually caused by a blow to the knee or a sudden twist of the knee. Symptoms often include pain, swelling, and difficulty in walking. Torn cartilage. Trauma to the knee can tear the menisci, pairs of connective tissue that act as a shock absorbers and also enhance stability. Cartilage tears can often occur with sprains. Tendonitis. Inflammation of the tendons may result from overuse of a tendon during certain activities such as running, jumping, or cycling. Tendinitis causes irritation and inflammation of one or more tendons, the thick fibrous tissues that attach muscles to bones. This inflammation can happen when there is an injury to the patellar tendon, which runs from the kneecap to the shin bone. ACL injury. An ACL injury is a tear of the anterior cruciate ligament, one of the four ligaments that connect shin bone to thigh bone. An ACL injury is particularly common in people who play basketball, soccer, or other sports that require sudden changes in direction. Fractures. The bones of the knee, including the kneecap, can be broken during falls or accidents. Also, people whose bones have been weakened by osteoporosis can sometimes sustain a knee fracture simply by stepping wrong. Knee bursitis. Some knee injuries cause inflammation in the bursa, the small sacs of fluid that cushion the outside of the knee joint so that the tendons and ligaments glide smoothly over the joint. Loose body. Sometimes injury or degeneration of the bone or cartilage can cause a piece of bone or cartilage to break off and float in the joint space. This may not create any problem unless the loose body interferes with the knee joint movement. Iliotibial band syndrome. This occurs when the tough band of tissue that extends from the outside of hip to the outside of the knee becomes so tight that it rubs against the outer portion of thigh bone. Distance runners and cyclists are especially susceptible to iliotibial band syndrome. dislocated kneecap. This occurs when the triangular bone that covers the front of the knee slips out of place, usually to the outside of the knee. In some cases, the kneecap may stay displaced and we can able to see the dislocation. Hip or foot pain. If you have hip or foot pain, you may change the way you walk to spare your pencil joint. But this altered gait can place more stress on your knee joint and cause knee pain. Symptoms. Signs and symptoms that sometimes accompany knee pain include swelling and stiffness, redness and warmth to the touch, weakness or instability, popping or crunching noises, inability to fully straighten the knee. Diagnosis. In addition to a complete medical history and physical exam, other tests for knee problems may include X-ray, MRI, CT scan, endoscopy, radionuclide bone scan. Risk factors: excess weight, lack of muscle flexibility, or strength. Certain sports or occupations. Previous injury. Prevention. Preventing knee injuries is not always possible, but a person can take precautions to reduce the risk. Maintain a healthy weight. Be in shape to play a sport. Practice perfectly and make sure the technique and movement patterns in sports or activity. Stretch your legs before and after physical activity. Wear shoes that fit well and offer enough support. Get strong and stay flexible. Keep your thigh muscles strong with regular stretching and strengthening. Use knee pads to prevent bursitis, especially if you have to knee a lot. Be smart about exercise. Stop exercising if you feel pain in your knee. If you want to make your workout more intense, always do it gradually. Proper nutrition, especially for athletes, is also important. Protein, calcium, and vitamin D are essential for maintaining healthy bones, muscles, and ligaments. Reduce alcohol intake, quit smoking. Homeopathy remedies: aconite, acid salicylate, epismel, arnica, aristolochia, belladonna, benzoic acid, berberis vulgaris, bryonia, casticum, colchicum, elaterium, Halmia, Ledampa, Lycopodium, picric acid, Passatilla, radium bromide, Rustax, Ruta, Sanguinaria, Sarsaparilla, Spigelia, Stellaria, Stricta, Sulfur, Symphyta, Tuberculina. For meantime, I have given these names: Epismel, Arnica, Bell, Berberis vulgaris, Bryonia, Colchicum, Halmia, Rasta, Ruta, Vedampa, Sanguinaria, Papagelia, Elaterium, Aristolochia, picric acid, and Stricta according to symptoms. Pain in foot or ankle and toe joints. Feet and ankle each have 26 bones which come together to form 33 joints. These comprise more than a fifth of the 206 bones in our body collectively. More than 100 soft tissue components such as tendons, ligaments, and muscles support the bones in the feet. The arch in the foot helps to spread the body's weight evenly across the many bones and joints. The metatarso phalangeal MTP joint attaches the big toe to the foot. This joint is vital for supporting the body and allowing the toe to bend up and down. The person's feet are a guide to general health status. Diabetes, arthritis, and cardiovascular disease are just a few ailments that are often start in the feet. Any injury or pain in the feet and ankle decrease the mobility and the ability to exercise, walk or run, further aggravating heart and lung complications along with sugar levels. Common causes for foot or ankle and toe joint pain. There are several common causes of foot pain. Joint pain may be caused by trauma, infection, inflammation, arthritis, bursitis, gout, or structural problems. Some causes include sprains and strains. Sprains often cause chronic foot and ankle pain. A sprain is an injury to a ligament, the tissue that connects the bone. The ligaments in the feet and ankles are particularly vulnerable to injury because they support a lot of weight and are used constantly throughout the day. Sprains can range from mild to severe depending on the damage to the ligament. A mild sprain may only cause discomfort, while a severe sprain can be extremely painful and make walking difficult. Stress fractures. A stress fracture is a tiny crack in the bone. It happens when too much force is on the bone, such as from running or jumping. The most common places for stress fractures are the foot and ankles. Capsulitis. Capsulitis is when the ligament of the joints at the base of the second, third, or fourth toe become inflamed. Tendinitis. Tendons are the fibrous structures that join muscles to bones. When these tendons become swollen or inflamed, it is called tendinitis. Tendinitis can occur as a result of injury or overuse. Playing sports is a common cause. Tendinitis is tendinitis also can occur with aging as the tendon loses its elasticity. Tendinitis can occur in any tendon. Commonly affected sites include the elbow, heel, knee, shoulder, thumb, wrist. Achilles tendinopathy. Achilles is caused by damage or inflammation in the tendon that runs from the calf to the heel bone. Tibialis posterior dysfunction causes pain, redness, warmth, and swelling in the tendon that connects the inside of the calf to the arch of the foot. Ankle or heel may feel weak and it can cause the arch of foot to drop. Plantar fasciitis commonly causes pain in the center and inner side of the heel. It's caused by damage to the strong band of tissue called the plantar fascia, which runs from the heel to the base of the toe. The plantar fascia should support the arch and help to spread the weight evenly through your foot so you can walk, run, or stand without difficulty. Bursitis causes pain and inflammation commonly around hard working joints such as the big toe, ball of foot, heel or ankle. It can also affect any part of the body. It is caused by swelling in a small pocket of fluid known as bursa or bursae if more than one is affected. Normally, these small pouches cushion and protect the bones, joints, and tendons from impact, rubbing, or pressure. Changes in the shape of arch. The arch is the inside midsection of foot. It determines how the body weight is spread and carried by the bones of the joints of foot. For your foot to function at its best, the arch should form a smooth arc from the ball of the foot to the heel. Some people are born with arches that are higher or lower than average and their bodies adapt to them. Other people may find their arch shape alters because of complications such as arthritis, weight, pregnancy, or injury. These changes can make you more likely to develop further problems in other parts of your foot, ankle, knee, hip, and back. However, arches that fall to drop from their normal shape can make you more likely to get overuse injuries. Your body posture or balance may also change, which can increase the strain on your legs, knees, hips, and back. Wearing badly fitting shoes, pregnancy, injury, or putting too much strain through specific parts of foot can all cause changes in the shape of feet. Sesamoiditis, sesamoiditis in the foot can cause pain at the base of the big toe on the ball of the foot. This is on the underside of the foot and not the top. Sesamoiditis is inflammation in the tendons surrounding the sesamoid bone. This is a form of tendinitis. It can also result from fracture on sesamoid bones. The condition often results from overuse of the toe, tough toe. Stub toe is a common sport-related injury. Creates a pain in the bottom of the big toe joint. The pain stems from a sprain or tears to a ligament in the toe. Bunions. A bunion is a bony lump that develops on the side of the joint at the bottom of the big toe. It can change the shape of the joint, making it bigger so it sticks out more. This is called hallux valgus. In extremes, it can alter the angle of big toe, making it bend towards other toes. You may find your big toe loses flexibility and becomes stiff, which is known as hallux rigidus. Soft, wide-fitting shoes reduce the pressure of the joint. Pressure on the joint. Bunion pads and insoles can also help relieve pain around the joint. Clad, mallet, refracted, and hammer toes. These are the conditions that cause the toes to curl and lift out of line. The main difference between each condition is the joints that are affected in the toe. These conditions are linked to several other foot problems, including bunions, flat feet, high arcs, tendon problems, and badly fitted shoes that squash feet. Arthritis and problems with the nerves in the foot can also cause them. Osteoarthritis. It is a very common condition which can affect any joint in the body. It's most likely to affect the joints that bear most of our weight, such as the knees and feet. Joints that we use a lot in everyday life, such as the joints of the hand, are also commonly affected. In a healthy joint, a coating of tough but smooth and slippery tissue called cartilage covers the surface of the bones and helps the bones to move freely against each other. When a joint develops osteoarthritis, part of the cartilage thins and the surface becomes rougher. This means the joint does not move as smoothly as it should. When cartilage becomes worn or damaged, all the tissues within the joint become more active than normal as the body tries to repair the joint. This repair process may change the structure of the joint, but will often allow the joint to work normally and without any pain and stiffness. Almost all of us will develop osteoarthritis in some of our joints as we get older, though we may not even be aware of it. However, the repair process don't always work so well, and changes to the joint structure can sometimes cause to contribute to symptoms such as pain, swelling, or difficulty in moving the joint normally. For example, extra bone may form at the edge of the joint. These bony growths are called osteophytes and can sometimes restrict movement or rub against other tissues. In some joints, especially the finger joints, these may be visible as foam, knobbly swellings. The lining of the joint capsule may thicken and produce more fluid than normal, causing the joint to swell. Tissues that surround the joint and help the support and help to support it may stretch so that after a time the joint becomes less stable. Sometimes osteoarthritis is a result of damage from a different kind of joint disease, such as rheumatoid arthritis or gout. Calcaneal spur. A calcaneal spur, or commonly known as a heel spur, occurs when a bony outgrowth forms on the heel bone. Calcaneal spurs can be located at the back of the heel or under the sole. The dorsal spurs are often associated with Achilles tendinopathy, while spurs under the sole are associated with plantar fasciitis. Lupus. Lupus sometimes affect the joints and joints and tendons, making the toes drift outward and the arches flatten. This can be painful and may make the feet feel stiff after a periods of rest. Symptoms. The pain may be accompanied by burning, redness, stiffness, swelling, bursitis, bruises, inability to bear weight, bruising, and or increased warmth over the affected joints. Diagnosis. Physical examinations, X-ray, CT scan, MRI scan, blood test. Prevention. To manage joint pain, reduce activity to avoid aggravating your joints. Switch to low impact exercise like swimming or cycling. Maintain a moderate weight. Wear foot brace or wrap. Regular exercise, a healthy diet, stress management and rest helps a lot to protect joints against further damage. Homeopathy remedies. Acid tart, ammonia carb, ammonia mole, epismel, arania diadema, arnica, acylcarb, Aramet, Bellispur, Berberis vulgaris, Bovista, Bryonia, Calcaria flow, Calcaria fast, Allotropis, Castica, Chamomilla, Colchicum, Crocus sativus, Digitalis, Ipterium per, Heclalava, Polonius, Ledampa, Lithium carp, Manganum, Medorinum, Nut Nigerian, Mimosa, Natron carp, Natramur, Natrasol, Propylaminum, Rustax, Ruta, Stilla, Stilleria, Strontinum, Chuja, biocombination number 19. Foods that relieve joint pain. Whole grains, fish, olive oil, cherries, turmeric, green tea, broccoli can help to relieve joint pain. I have given for anti-pain ammonia carb, arnica, bellispur, calcaria fos, casticum, gadampa, ruta, natricarb. For heat pain, ammonia carb, arania, berberis vulgaris, cyclamen, lethidus, lycopodium, vitalaca, passatilla, lemon carb. For calcaria spot, calcaria flow, arania diada, rustax and ruta. With this, my presentation, I am completing my presentation. Thank you, Ananda, for hearing to me.
Thank you very much. It was so exhaustive and elaborate. There is no more areas which I have not touched. Murthy sir will continue. Murthy sir, please.
This is a big topic, sir. That is why.
Yeah, it is good. You have covered almost. There is no point there.
I did, but I omitted muscle part. I have not given the measurements related to muscle.
Yeah,
Please
sure.
make a note because this is about joints. I have touched only joints. Otherwise, it will be more.
Yeah, no, we'll have to take three or four classes.
Yeah, so I have omitted muscle part also. I have omitted.
Yeah. Murthy sir.
Okay.
Thank you very much, madam. You have prepared a nice book on rheumatism. It is a part 1. Part 2 we will complete with the muscular system and gout also.
Sir, how to come out, sir? This. Okay. Okay, stop there.
You are coming out, doesn't matter. Okay, thank you very much. Now time is over also. Any doubts in this? We will clarify all the doubts from next classes.
Okay.
Because so much of vivid description madam has given about all joint pains, not even one single, everything except gout, everything she covered.
Okay.
Because gout itself I told don't touch, because gout is a separate subject, we have to take in a different manner.
I have aspired, sir, because I have reached all your expectations are not. I tried so much of time, I spent so much of time, 2 times I just
It covered almost
Yes,
covered
yes.
everything as he said, and it was elaborate and extensive. Now we will have to look for part 2 and part 3.
Yes.
It covers the muscle and gout and other areas.
You prepare the muscle part and gout also. Next month or within 2 months we will cover that also. Okay, thank you madam. Thank you very much our all
Very nice
members.
lecture. Thank you.
I will send the PDF, sir, because I have not completely explained the medicines because time is not there. So I will send the PDF for everybody.
Yes, thank you.
Thank you very much for that.
Thank you. Thank you.
Thank you, sir.
Thank you sir. Thank you very much. We will meet next class.
What sir? Anybody has to